Okay, so the lowest life expectancy in Cuyahoga County is Huff, which I had a tour through yesterday. And actually, I couldn't quite understand why Huff was so low. It wasn't a terrible looking place to me. And I understand it's changed quite a bit. This is around the 2000 census. 64 years of age, on average. On average. Hit it again. And Lyndhurst, the highest in Cuyahoga County, 88.5 years of age. Now, all of you do the math in your head. 64 from 88.5, that's 24 and a half years. That's the highest I've ever seen. We did Baltimore. Baltimore had about 20 years as it's been the highest and the lowest. This is as high as it gets. 24 years average life expectancy difference. So either, for some reason, people with very bad habits decide to live in Huff disproportionately, and people with very good habits, I mean, this is what our medical model mentality would dictate, decided to live in Lyndhurst, or place somehow matters. The context of the how people live, where people live, what they have access to matters in shaping these outcomes. Because this is not a random distribution. There's no way you can get 20, almost 25 years of life expectancy difference just by sort of random assortment of populations. So who's horrified by this? Good. Good. This is why this meeting matters. Because the goal here is to turn as much of this map dark green as possible. That's the goal. Next slide. Okay, so here's Alameda County again. One of the other things you can do, and hopefully we can do with Cuyahoga County at some point, is hit it again, is you can look at the green areas in aggregate. Hit them again. We know the life expectancy is greater than 80 years, and literally, when you look at aerial maps of the green areas, they're green. They're actually green. Lots of trees, nice homes, in-ground pools. When you look at the measures of social status, high rates of high school graduation, low rates of unemployment, relatively low rates of poverty, high rates of home ownership, and in Alameda County, which is very diverse, it's about 50-50 white and non-white. Next slide. Hit it again. And again. And the yellow areas in aggregate, now here's a selection of a picture of yellow areas, slightly smaller homes. Now you're seeing a little less green, a little bit of the above ground pool sort of situation. High school graduation rates are a little bit lower at 81%, unemployment at 6%. Poverty is now 10%, home ownership is down to 52%. This is around the 2000 census, by the way. It's about 16% non-white. Next slide. And again. When you look at the red areas in aggregate, hit it again. Now here's heavy industrial across from residential, spewing diesel particulate emissions. High school grads are only 65% of this population. Unemployment is 12%. This is around 2000. This number is probably doubled by now. Poverty is a full quarter. Home ownership is down to 38%. It's now 90% non-white. So just as death is not randomly distributed, people are not randomly distributed in Alameda County. And I would guess probably not Cuyahoga County either. Next slide. And people have, of course, been wondering where the poor people live. Well, there's the boot. The poor people live in West Oakland, parts of the Flatlands, East Oakland, parts of the incorporated area, and parts of the city of Hayward. And a big spot there up in North Berkeley, which is not really poor people. They're just students. They're not really poor. They're just acting poor. And they will be fine. Next slide. So you can take the poverty map, which is at the census tract level, and you can take the life expectancy map at the census tract level, and you can do a very simple thing. On one axis you put poverty, on the other axis you put life expectancy, and you come up with what's called a bivariate correlation, just trying to see if these two things are related to one another. Next slide. And this is the relationship that you get, basically, as poverty increases, life expectancy decreases in Alameda County. And in an ideal world, this would be a flat line. It would, how poor the community you lived in wouldn't dictate how long you live. But we don't live in an ideal world. And Alameda County is not an ideal world. And many people, when I show this slide, they say, oh God, I'm glad I don't live in Alameda County. Well, next slide. We did this we try to do this every place we go. We did this in San Francisco, we did this in Contra Costa County, and you see this relationship. Next slide. We did it for the Bay Area as a whole. This is representing about 6.5 million people in the Bay Area as a whole. And this is the relationship here. And you see, one of the things that you see when you do the scatter plot, what this is called, it's this sort of almost meteor-like picture where there's a clustering of sort of like census tracts that are quite long-living and high wealth. And then you have this tail of poor census tracts where life is less long. And you almost have this impression like, people are in the wealthy communities are pulling away from the poor people. It's like this, they're sort of shooting off and the poor people are left behind. You can actually use this slope to calculate a very interesting number, next slide, and that is that $12,500 in household income in Alameda County buys you a year of life. So I joke to people that this is the number you should be using when you're negotiating your next raise. Well, we've actually done this in Baltimore, New York City, Philadelphia, Minneapolis, St. Paul, Colorado, California, and now Cuyahoga County, who is cheaper than Alameda County. You can buy a year of life here for $6,300. So that's a deal. And you should be impressed by that. No, but seriously, this is shocking. You should be able to predict this anywhere. But you can't, because we have these patterns of the way we built our societies that essentially dictate a whole host of outcomes for folks, including health, length of life. Next slide. Okay, so Cuyahoga County, you can do the same thing. They're both on a census tract platform. Hit it again, and you come up with this relationship. This is now looking at mortality, which is sort of the inverse of life expectancy, and poverty rate. And as I told you, $6,300 buys you a year of life in Cuyahoga County. Next slide. These are a whole host of places that we've done this comparison in. No place have we found a flat line. We have not found a flat line. There's one circumstance under which we find a flat line, which we can talk about later, but no place in overall life expectancy or mortality rate against poverty do we find a flat line. Next slide. Okay, so you've got to ask yourself, so why is this? I mean, I came to Alameda County in roughly 1996 originally to the Public Health Department, and then went to Connecticut and came back. And, part of our problem, I think, is we don't look at the history of places when we try to understand how these phenomena are manifesting themselves across populations. So we decided to look in the history of Alameda County, and I'm a lawyer, so I like law. Law tells you a lot about society. And so I researched a bunch of cases and found this. Hit it one time. And again. Some of you may know what this is. Others may not. This is a racially restricted covenant. I'm going to read it to you. It says, no person or persons of the Mexican race, whatever the Mexican race is, by the way. No person or persons of the Mexican race or other than the Caucasian race shall use or occupy any building or any lot except that this covenant shall not prevent occupancy by domestic servants of a different race domiciled with the owner, tenant, or occupant thereof. And some people, when I showed them this, they said, oh, well, they're racists all over the place. And, this happens. What can you do about it? Hit it again. Well, this is actually federal housing policy. This comes from the Federal Housing Administration Manual in 1938, and it says it's necessary that property shall continue to be occupied by the same social and racial groups. Necessary. Federal policy. So, does racially restricted covenants just exist? I mean, do these things just randomly occur? Or are they driven by an intentional policy to segregate people according to race? Well, there's my data. Where's yours? Next slide. So we found these racially restrictive covenants all over Alameda County. We're continuing to look for them. I put it to you that we'd find a lot in Cuyahoga County as well. Now, why is this important? It's trying to understand how we set up these land use patterns that have deleterious health effects on populations. This is not just about people choosing to live in these neighborhoods. Many of these people and their parents and their grandparents and great-grandparents had no choice about where to live. Let me try to show that to you in Alameda County. Next slide.